Hello and welcome to another medicine episode. Today we're talking about epidermolysis bullosa, which is a group of rare diseases which are characterized by blistering of the skin. You might be familiar with the term butterfly children for those who are affected. When we're talking about epidemiology, we can say that about 20 out of 1 million newborns suffer from the disease. Over 80% of those suffer from the subtype Epidermolysis bullosa simplex. The disease affects both sexes equally and can be inherited in an autosomal-dominant or recessive way, but usually it's autosomal-dominant. The principle is depicted here. So if one parent is affected, half of its children will inherit the condition as well. Around 500,000 people are affected worldwide. When we're talking about pathophysiology, we have to say first there are over 20 forms, but we've got 4 major categories. So EB simplex, junctional epidermis bullosa, dystrophic EB, and Kindler's syndrome. There are a few causes, but in general it's all about proteins that are responsible for attaching the skin to the underlying tissue, and those are defective. So the skin is very, very sensitive, and also minor irritations like a tight fitting shirt might cause blistering and sores. Coming back to EB simplex, so the most common subtype, the disease is caused by mutations in the genes KRT5 and 14. Those code for keratin, which is a key structural material for skin. And here you can see it's a monomer that forms dimers, that forms tetramers to get to its 3-dimensional structure. Now let's talk about the phenotype. So all subtypes show this blistering of the skin, whereby the severity of the wounds differ. The skin lesions might cause an imbalance of fluids and also protein wasting. And there are also secondary complications, including an abnormal amount of collagen. This then might have a negative impact on wound healing. Furthermore, the sufferers are more prone to malignancies of the skin, so cancer. Other complications are anemia, so the lack of red blood cells, and also growth retardation, which is caused by the loss of protein. And as I suggested before, the extent of the severity of the wounds varies greatly. So there are forms which are lethal at a very young age, and others might have symptoms that are so mild that they become clinically apparent only in adulthood. For diagnosis, there are 2 major ways. So you can either do a skin biopsy, where a specialist takes a look at your skin under the microscope, or there's also genetic testing. So far, over 300 mutations have been associated, so we have to make a differential diagnosis between the various subtypes. A general tendency of EB is that the lesions are less severe with progressing age, but we have to keep in mind that there are subtypes which can cause severe disability. When it comes to treating EB, we have to say that there's no way to heal EB at the moment. But there are specific treatments to lessen the symptoms. So the first and most important step is to prevent trauma as thoroughly as somehow possible. But the blistering can also occur spontaneously. The wounds then have to be treated to promote healing of the skin. And especially for children, painkillers might be an option, predominantly when they're stressed. In general, it's essential to closely monitor those people. And the treatment involves an interdisciplinary approach. So many specialists have to work together to find a treatment that is most beneficial for the patient. There are ongoing clinical trials which evaluate the potential usefulness of also other treatment options. For example, an experimental approach is to transplant healthy skin, but obviously those treatments are not yet ready to be applied for many people. So epidermolysis bullosa is a very demanding disease, not only physically but also emotionally. And therefore, people need lifelong support. And again, the main characteristic is epithelial fragility. This was a quick overview of this disease. If you like this video, give it a thumbs up. Don't forget to subscribe to see weekly uploads, and see you in the next video.